Hands Endoscopy. And to introduce the first speaker, I'm very honored to introduce my very good friend, Masfiq Huiyan from Bangladesh. So he is a minimally invasive surgeon and surgical endoscopist as well, who has dedicated his life for endoscopy, and he will talk about image-enhanced endoscopy.
Thank you, good morning. And I see a lot of endoscopic giant me sitting, there's a speaker and respected chairs also. Honored to be here in the World Congress of Endoscopic Surgery 2024, and also grateful to Professor David Roman. My presentation has no conflict of interest, and this session is chaired by Dr. Ali, Adjunct Governor from Philippines, and Sri Ganesh Murthy, friend of good heart, and Professor Tobikul Alam, the father of surgical endoscopy in Bangladesh, and my mentor. And so my topic is image-enhanced endoscopy. I belong to this institution at Anandhi College Hospital, Dhaka, Bangladesh. It's the largest general hospital, and I work there as an assistant professor of surgical gastroenterology. And as I mentioned, I'd like to introduce myself as an endoscopic surgeon. So before starting the image-enhanced endoscopy, I want to share one thing, that I have an iPhone. The previous years, that is the iPhone 16. The next year, the iPhone 17 will come. And what is image-enhanced in our daily life is happened. The iPhone started from one camera, and we see 3 cameras, and the image is increasing more and more. And in case of our daily life, this mobile will see a lot of good resolution pictures there. And in endoscopy, what happened? Actually, in endoscopy, you see the inside the GI tract, so you examine the mucosa. The mucosa. So when NASA see the deep galaxy spaces, with endoscopy exploring the detail of the body surface and the normal mucosa, how detailed we can observe and we can delineate the structure, anatomy and pathology. So initially when the Hubble telescope was in the space, that was blurred, and the scientists think that this actually the universe is blurred. Then they set up and adjust the camera, and the universe become clear. So image is very much important to go forward thinking, further thinking. So endoscopic imaging, you see the conventional image enhancing is chromo, means dye with endoscopy, optical, digital, some actually the software enhanced imaging and digital. So chromo endoscopy actually we use commonly angiography and the magnification with NBA. NBA is a special moves from Olympus, and the eye scan from Pentax, eyes from the Fuji, the BLA also from Fuji. Ultra high magnification, what are some modalities? So that I mentioned earlier. So actually I want to mention easily that in the surface we use some dyes to increase the breeze of the surfaces. That means a brick surface is more prominent when it is stained with color. There is some principles of dye application. We will not go detail because we are running out of time. So you see actually seeing with dyes and seeing without dyes is just a practice for the endoscopy. And someone said, do we have to do the whole GI tract, do the chromo endoscopy? No, it's for special investigation for suspected area of the GI tract where there may be some different things is happening. So you can see the eye scans how change and demarcation of the surfaces and make a attenuated structure more prominent. So you know that after that the Bates classification actually happened. And when we see more, we think more, we just mapping the pathology more details, and you see the classification is there. And the peak pattern has come because we can see more. When you don't see, there is no peak pattern. There is photo peak pattern and cyno classification is there. We can see the breeze of the mucosal change in the, especially in the right colon, where usually is the subtulation. So NBA would not usually detect actually the pathology. Sometimes the image enhance also help to detect the normal anatomy findings, sometimes in the RCB, sometimes in the diabetic, like this, the opening may hide. Even in finding the opening the pancreatic duct and bile duct also after PCAT or ampulectomy. This is a simple increase the structure and image, how sharp it present to us, and it increased the targeted biopsy. See, in the normal after ampulectomy, sometimes we're getting struggle to find out the pancreatic duct and bile duct separately. So we are using the cholecystoscope also. The principle of narrow band imaging, using some two bands and increase the enhancement and the deeper mucosa and the vasculature of the mucosa is also increase, and it can give more colored image. So ultra high magnification is another thing. Confocal laser endomicroscope. So this is a picture. Say histopathology, just make it slide and make a picture. So endoscopy, we include the microscope in the endoscope. So nowadays, in current imaging endoscopy, in GI disease is a great role, chronic gastritis, adenoma, and early cancer. You see the change in the pattern. You can easily demarcate when you see by the enhanced imaging. So we add some extra magnifying imaging, the NBI added some extra benefit, more enhanced. So that's the principle, actually vascular pattern differentiation of the intralobular loops classification. And confocal laser endoscopy and civil image in various gastric lesions. Nowadays, the Japanese are frequently uses this technique. And now new shifts has come in the old territory, the red dichromatic imaging. So finding the bleeding is challenging, laparoscopy even in endoscopy. So finding the bleeding point when the bleeding is happening is really challenging for the endoscopy. So this RBI actually helps to detect the bleeding point and grade it, so the procedure become less harder and less time consuming. You see, the bleeding point is easily detected by RDI technique. So then I mentioned that endoscopy and MPI mixed with all the technologies to get the more benefit to detect the disease and classify the disease. You can see the simple hyperplastic adenoma, white light in advanced adenoma detection. And in the NBA, you can compare it. I think this is a practice to just do a common practice to see the change in the NBA more frequently. So I mentioned is previously. So endocytoscopy, I mentioned that the dual CCD endocytoscope, actually the endoscope with magnifying endoscope. Someone is just like I mentioned in the iPhone, there is many cameras that increase the actually pixel megabyte. So generation of endocytoscope, these are coming, this will come. The future will have to adapt. So using the normal endoscopy and endocytoscopy, we can delineate some more and more people like space. The common there's some principle to use this one. In the esophageal classification, in the barriers, they have great role. So now I want to add Professor Chini So is an endoscopic giant. I see a lot of lecture in YouTube also. And he will talk about the AI in endoscopy. So I want to add one thing, the third AI is the third eye for the endoscopist, and differentially solve the problem. Someone says phase 2, someone says phase 3. They will solve the problem. They have the chance. They will assist us and go and assist us to the more accurate one. So this is the without AI. Definitely it will assist the endoscopist to find out the more adenoma. And I want to mention one thing that only water can increase the enhancement. You have nothing, no problem. Do underwater colposcopy. So I want to mention that the mind doesn't know. I cannot find. That's a saying. But AI can. The one thing is, if any doctor is not adapted with AI, a doctor without AI will be replaced by a doctor no AI. I think that should be the future. So I'm happy to share that this is a book written with one of my Japanese colleagues, Tomoyuki Karube, and this is the painless water-assisted colposcopy. And it's a very unique technique, and we've done a lot of cases, more than 20,000 in our center, different centers. So I'd love to share this book. If anyone is interested in this book, please personally contact me. Thank you.